Today's the day many across the country have said for months they've been waiting for. Pfizer's COVID vaccine is now officially approved for use. Up until now, it had emergency use authorization only. The FDA's decision to fully sign off came this morning after reviewing hundreds of thousands of pages of data from tens of thousands of trial participants around the world. But before today's announcement, the agency, unfortunately, had to make this one as well. You are not a horse. You are not a cow. Seriously, y'all, stop it. That tweet comes in reference to the potentially deadly new push by some anti-vaxxers to use a livestock deworming drug called ivermectin to both prevent and treat COVID. If only there were some alternative suitable for humans to help the multiple states running out of ICU beds or to stop another American dying from coronavirus every 85 seconds, which is what we've been averaging over the past week, as the president urged companies to take action today.
Step up with vaccine requirements. I call on you now to do that. Require it.
Hours before that, New York Mayor Bill de Blasio declared that his city will require every employee in the Department of Education to be vaccinated, from teachers and principals to custodians and office staff. And unlike almost every other mandate we've heard about so far that leaves the door open for testing if someone doesn't want to get the shot, in this one there will be no option to opt out. Of course, public schools are certainly an area of concern as classes resume, but colleges and universities are also navigating some tough decisions as students return for the fall after a year of near lockdowns on many campuses. I'm joined now by a man who's been studying this issue for months. Dr. Sandro Galea is Dean of Boston University School of Public Health and the author of The Contagion Next Time, available for pre-order now. Dr. Galea, thank you for being here.
Thank you for having me.
How big a deal, from your vantage point, is the full FDA approval of the Pfizer vaccine?
I think it's a big deal insofar as it makes it clear that this has gone through the strictest levels of scrutiny. It is a safe and effective vaccine, and everybody should get vaccinated. The reality is nothing has changed from what we've known. Nothing has changed from when it was approved under Emergency Use Authorization. But given that we are in a situation where we have 20-30% of the country continuing to resist vaccination, it feels to me the more official we can be about it, the more formal we can be about it, that it really has the best possible good housekeeping seal of approval. I think that's important.
When I heard this news, I found myself wondering, well, how many people who've been vaccine skeptics or vaccine hesitant are actually going to change based on this? Will they find some other reason not to take it? I had not known at that point that there's a new or relatively new Kaiser Family Foundation poll that came out prior to the official approval, which said 3 in 10 unvaxxed people are more likely to get the vaccine following full approval. If that number holds up, if 3 in 10 actually decide, okay, I'm going to go ahead and do it now, 3 in 10 unvaxxed people, epidemiologically, is that a significant shift?
Yeah, it's a great question. The answer is we don't know, because what we really are dealing with right now is a balance between number of people vaccinated, number of people who've been infected, and having enough of those two together to reduce the pool of us who are susceptible to reduce the spread of the virus. The question is, how big is that pool, and how big do we need that pool to be? And the reality is we do not know, of course, because the virus changes. The Delta variant that we've heard a lot about is the same virus, but it's more infectious and more pathogenic when it infects people. So that changes the equation. So we are in this constant battle to have enough people vaccinated. That, added with people who have the infection, means there are fewer of us who can get COVID-19, which means that the COVID-19 pandemic then slows down. And the sooner we get there, the better it is, so that we can all move on with our lives.
I mentioned Bill de Blasio's very aggressive new mandate for public education employees in New York City. Now that the Pfizer vaccine has full FDA approval, to your mind, is there any reason for the nation's colleges and universities not to say to all students, faculty, and staff, you need to be vaxxed before you come back this fall?
So the question of mandates is a really interesting question, right? At some level, there is an argument to be made that why should we collectively tell each other what to do as adults? And we actually have no precedent for this. We do not require vaccination of adults for anything else. We do it for children, of course. We do it for a lot of things for children. So I actually do appreciate the resistance at that level. There is this notion that you are telling me to do something to my body. And if it were just about my body, I think it would be a much more complicated question, because then it would be, well, could I choose to get COVID and it's my problem? But it's not just my problem, right?
Right.
If I have COVID, it makes it more likely that I'm going to infect you if you and I are in the same room. So this is where the picture gets more complicated. And this is why vaccine mandates, to my mind, and I think to the mind of many experts in public health, make a lot of sense, because we are not simply saying you're going to protect yourself, you're going to protect others, and we are going to protect each other. And that's why you see many colleges, including ours. I'm a faculty member at Boston University, and we are requiring vaccination for faculty, staff, and students have required it. That's why you see Mayor de Blasio requiring it for employees in New York City. It's not simply to protect those people who are vaccinated, but it's to make sure that you protect everybody else. The more of us who are vaccinated, the more of us will be safe, which is why getting vaccination up is so important at this point.
I know BU and a number of other area schools are also requiring masking indoors in common spaces, even for people who've been vaccinated. To your mind, again, leaving politics aside, because there are obviously vast swaths of the country where this won't happen for political reasons, but would mandatory indoor masking be a prudent step for institutions of higher education to take heading into the fall?
Yeah, to my mind, it is prudent. Adam, I really like to use the word prudent. I think it's the right word, because what we know, right, is that we are implementing layering of protections. So you have vaccination, you have HVAC filters, you do as much as possible outside, and you do masking indoors. These are all layers of protection. None of them in and of themselves are 100% proof. And in part, some of the sad thing about the vaccine argument has been saying, well, if you're vaccinated, you can still get the virus. Well, of course you can. That's true for any vaccine. But what you're doing is you're layering protection. I think given the Delta variant, given the cases in the community right now, being masked indoors for indoor congregation makes sense. That will not always be the case. That will hopefully stop being the case in a few months once our cases are quite a bit down. Really what you're doing is you're balancing the risks and what we're giving up to mitigate those risks.
When it comes to risk management, I want to ask you a little more about the reality of life on a college campus, because obviously, even if people are vaccinated, even if people are masking in indoor spaces, college, if I recall correctly, is a time when people tend to congregate in large numbers. The students are not necessarily as risk conscious as they might be 5 or 10 years later. And there is a minimum of adult supervision. It's the stage that we send young people to as they leave childhood and head toward adulthood traditionally. Given all that, is there anything else? I assume there's something else. What else can schools be doing to try to keep students safe as they go back?
Well, let's start with the college kids, then we'll talk about what else.
Okay.
I actually want to give the college kids more credit. I have been very impressed by how responsible college students have been. I've been very impressed by students recognize that this is a collective problem. I've been very impressed by their using masks indoors, getting vaccinated. We've had student-led campaigns to encourage vaccination, encourage masking. So I actually think that by and large, students, maybe it has changed, maybe it's also changed in the past 20 years, that students are being really responsible. And I really have to tip my hat to them. I think they're really doing their part to actually be safe in this moment. Now, what else are we doing? There's a lot of things that actually we are doing specifically. I'll talk about Boston University and then we can talk generally. So we have a system of routine testing, which we had over the past year. We've tested about 1.3 million people at this point. And people who are tested positive are immediately isolated. We do contact tracing, make sure that a case doesn't become a cluster, which doesn't feed the epidemic itself. We have ventilation, filtration system in all classrooms. So we really have been layering systems, and we've been doing that for the past year. For us at Boston University, we now have, unfortunately, an 18-month experience with that, and many other large universities have similar degrees of experience. So one hopes that it is all those things together that give you such a confidence in low risk of transmission. We know, for example, that our university transmission throughout 2020, 2021 was 1/10 what it was in the community. So it was actually quite a bit lower.
That's a remarkable statistic.
Yeah, it actually, and the reason you can do that, of course, is because in a university you have control over a lot of these things. So if you do it right, you can actually implement controls that reduce transmission quite a bit.
I have to say, I'm really glad that you set me straight about college students and how they behave. A, because it might mean less angry emails from people taking on with my description, and B, just because it's really good to know, and it's a heartening thing to hear. Rice University, as you know, shifted temporarily as they begin the school year to online-only education because they said they were seeing a very high number of breakthrough cases. It turns out there were some problems with, I think, at least one firm that they were using to do the testing. The breakthrough problem wasn't as bad as they originally thought, but they're sticking with their plan to ease into the year with online education. How likely do you think it is that as we go deeper into the fall, that we're going to be able to avoid having to go back to online ed, at least temporarily, here in the Boston area, but also around the country?
Well, I think if there's one thing we've learned during COVID is never to say never, never to say no, never to say yes, and to really be aware that data change all the time. So with that caveat, I hope that what we are going to see is a cresting of this wave of the Delta variant, and where we start seeing cases going down because more people are vaccinated, more people have been infected, and that will allow us to continue college education, high school education, primary school education in person. Now, the reason I hope that is because the data are pretty clear to my mind about how much loss there is to educational value when we are doing things only online. That does not mean that there is not a lot of space for online. There's not a lot of space for hybrid education, but it simply says that kids, young people, certainly in primary schools and high schools, are losing a lot by not having in-person experience. And similarly, college experience so much of it is predicated on the networks that the undergraduates and graduates are forming, the interactions with professors, and on the learning that comes with being around a community of other students like them. So I really hope that we are collectively able to continue doing what we're doing to move towards in-person learning with hybrid facilitation, learning from what we've learned about digital learning to supplement the in-person learning, but fundamentally make our learning an in-person community of learning.
Thank you so much for having this conversation. I tend to be a very pessimistic person. I feel more hopeful after talking with you, and I hope people who are watching at home do as well. Dr. Sandro Galea, thank you.
Thank you.
Again, his forthcoming book is The Contagion Next Time. It's now available for pre-order at sandrogalea.org.